I want to send a message to everyone living in Leicester, Leicestershire and Rutland in Dying Matters Week. As a working GP, I believe this is one of the most important things that I can say to you. You know, death, dying and bereavement is a very important part of my work. In many cases, patients with serious conditions like cancer or heart disease or lung disease prepare and plan ahead, working with their doctor and nurse, and they have a good death cared for in their home by a service that supports them.
The benefits of care planning are that you can be very certain about what sort of care a patient wants to receive around the end of life. So if somebody's coming towards end of life, they can come to see me and we can discuss about scenarios, and I can ask them questions about, in this certain situation, what sort of care would you like to receive? And then we can document that. We can put it into a physical care plan that the patient can take away and keep at home. And then I can take information from that and I can put it into a special patient note, which I can then send out to the out of hours services, so they are also aware of the care plan and any significant points within it. The first thing that can be done, and that all patients should do, regardless of their stage of life, is come to see their GP and discuss setting up a shared care record. Now, the great thing about this is it's the one thing that somebody can do to immediately improve the care that they get across the board.
Sometimes, however, due to a fear of thinking about death or a taboo about a very difficult subject, patients don't get the care that they need and they die perhaps in the ambulance or the hospital. I want to put an end to all that. So in Dying Matters Week, I'm going to ask you the question, are you prepared? Are we prepared? We should think ahead. So in the event of serious illness or diagnosis like cancer or heart disease, let's live and die well, which means thinking about the sort of care you would like, where you'd like to be cared for example, in your usual place of residence, which is normally your home or your care home.
It's not something that we normally ask people day to day, and it can sometimes be quite tricky to raise this, but when you do talk to people about it, often people prefer to die in their homes where they're comfortable, where they have their loved ones around them. And we can communicate that with the out of hours services and the ambulance crews, so that if they are involved, they know that the majority of the time we want to be caring for the patient here in the community where they feel most comfortable.
As a GP and a local leader, I'm pulling together all the institutions and the hospitals and the voluntary sector and the community nurses and the hospice like Laura's. We're going to work together to meet your needs through a task force that I'm leading to improve care and services. In summary, it's not too late to plan ahead or to think ahead. So if you've been diagnosed with a serious illness or worried about your future, please talk to your doctor or nurse about an advanced care plan. Thank you.